Okay, so day one with my MARPE. So I got it placed yesterday, and when the numbness wore off last night, I actually had no pain. Now, I will say, because I have placed a lot of these myself, and we do a lot of these in our practice, everybody has a different pain response and a pain tolerance. So I felt a lot of pressure, and I took, all I took was Tylenol and ibuprofen before the procedure, and then right before bed, because I had no pain, but I was feeling pressure. I knew that I might get a headache, because that's a very common response for a lot of people. So I decided to take Tylenol and naproxen sodium before bed. And then at like 2 in the morning, I had a headache. Just kind of like a throbbing, not even a bad headache, but it was enough to keep me awake. So I got up and I took Tylenol, and that was it. And I did pick up my prescriptions just in case I needed them, but I haven't needed anything. I think what's really important to note in the first few days in the first week of getting a MARPE is that you got to keep it really clean. You have to understand that, like, if you had a splinter, your body's going to get really inflamed and try to fight it. Anytime you put screws into your mouth like that, your body's going to try to fight it. So inflammation can start to get out of control really fast. You don't want the tissue around the screws to get inflamed. So like last night I had sushi, that's hard to say, without any rice. I just had the fish and I had miso soup. Kept it really simple, so I wasn't chewing a lot. I wasn't getting food embedded in there. If you get food embedded in there, that can really irritate the tissue. So in the first, week, try to keep inflammation down, and try to not eat like a hamburger or something that just packs in there. A lot of carbohydrates are really hard to clean out. So if you go and eat bread, anything that like mushes up and gets stuck in your teeth will get stuck in all the nooks and crannies. So also I would avoid things like nuts and really hard things that, like a pistachio, could get stuck in there. So really keep it liquidy and soft. And then just make sure that, like, as soon as you can after you eat, you want to take a water pick on low. So you don't want to put it on high. And just like if you had a brand new cut, you got to clean it gently. So you don't want to put it on high and blast it, because that would hurt and irritate the tissue. You want to put it on low or medium, enough to get the food out. And then I also use a toothbrush called Nimbus. That's my favorite brand. They're soft bristles, but they're longer. So I can actually brush the whole appliance as well. And I can brush, I have hooks, so I can even brush the hooks and get food out. Also, you want to stay away from acidic foods or really, really spicy foods, because again, that can irritate inflammation. So later on, once you're totally used to it, the tissue is under control, you can be more brave and kind of eat more normal foods if you want to pick it out of there. But at the beginning, you don't want the inflammation to get bad, because then you'll have more pain, and also you don't want to lose a screw. The main reason that we lose a screw or your body rejects it is from inflammation. So the more that you can keep it clean, the better. So anyways, I don't tend to have a big pain response if I have surgery or any procedure. So I feel like most people, especially if they have dense bone, and a lot of men are harder to do MARPEs with because their bone is more dense. It's harder to get their sutures open. We tend to do steroids a day or two before the procedure with them. I opted not to do that because like I said before, I'm more of a naturalist, so I don't want things in my body, and I wanted to feel the whole experience. So most people are going to have some sort of pain and have a pain experience, and you need to be prepared to manage that. So just because I didn't does not mean that you're not going to. That's the best case scenario. But what you can do is have a low anti-inflammatory diet. Do not put really hot foods in your mouth, or really spicy, or really citrusy, or really acidic foods, and keep it clean. Also, you want to do saltwater rinses at least twice a day, if not more. And then I swish it, and I gargle it too, because it's really hard to swallow because it's breaks your suction, and it also is hard to swish. So if you gargle it, it kind of goes through the appliance a little bit more. And just do it as long as you can. I also found that it's really helpful to drink ice water. So I'm kind of weird. I love ice, and you don't want to chew ice because you can break this, but I like to suck on ice, and it actually feels pretty good in the palate too. So, if it gets stuck up there, don't panic, it will melt. All in all though, day one's fine. I'm actually considering starting to turn it. I'll probably do my first turn tonight or today when I get home. But obviously you need to follow your doctor's recommendations because every person is different. And the turning protocol that I give for my patients is very different. For a kid, a teenager, an adult, it's customized. So you need to make sure that whoever is guiding this, which hopefully is an orthodontist, it should be an orthodontist doing this, that they are guiding you on the protocol. So one thing that's really helpful is if your orthodontist puts what's called like soft flow or some sort of soft material over the screw heads, it really helps your tongue. Your tongue can be one of the most painful things when you get anything put in your palate because it's really irritating to the tongue. When you brush your teeth, you should really brush or scrape your tongue to keep it clean. Saltwater rinses also help your tongue, but otherwise, again, low acidity foods and all that will also help your tongue heal faster. And so even if you have a soft flow, sometimes it can still just be irritating. You'll see an imprint on your tongue with all the screws, and that will go away over time a little bit, but then really once the MARPE comes out is when it will really go away. Your mouth will salivate like crazy and it's hard to swallow. So it's kind of weird, and you might make some weird noises when you swallow, or even just like trying to get it out of the expander. So don't be embarrassed, but that will get easier over time. But day one, your body is thinks that it has a foreign object in there. So it makes so much more saliva, and that is very normal. Yeah, day one's been good.